I get this question constantly from my patients. How dangerous are Viagra, Cialis, Levitra, and Stender for my heart? It's one of the most frequently asked questions I receive, and I understand why. There's a lot of misinformation out there, and people are rightfully cautious about anything that might affect their cardiovascular health. My name is Dr. Eva Daniel, and I'm a cardiologist and physician. Today, I want to help you understand the truth about PDE5 inhibitors, what they actually do, why they're safe for most people, and why one particular myth has persisted for so long despite being largely false. The reality is that hardly any drug class has been more mystified and misunderstood than PDE5 inhibitors. Much of what the general public believes about these medications, particularly their effects on the heart and blood pressure, is simply not accurate. So let's set the record straight. The origin story, how Viagra came to be. To understand why these drugs work the way they do, we need to go back to their origins. Viagra, the active ingredient of which is sildenafil, wasn't originally developed to treat erectile dysfunction. That's not what researchers were looking for at all. Sildenafil was originally developed as a cardiovascular medication. Specifically, it was being investigated as a treatment for angina pectoris, the chest pain condition that occurs when the heart isn't getting enough blood supply. For decades, the standard treatment for angina has been nitroglycerin, a medication that works by dilating blood vessels, which lowers blood pressure and improves blood flow to the heart. The problem with nitroglycerin, however, is tolerance. Over time, the body becomes accustomed to the medication. You need increasingly higher doses to achieve the same therapeutic effect. It's a frustrating clinical problem, and researchers were looking for a substance that could provide similar benefits, vasodilation, and improved blood flow without the tolerance issue. In their search, researchers identified a specific enzyme they thought could be blocked to achieve this goal. The enzyme was called phosphodiesterase 5 or PDE5. They developed sildenafil to inhibit this enzyme. It seemed promising in theory, and clinical trials began. But here's where the story takes an interesting turn. The drug largely flopped in terms of treating angina. It didn't work as well as they'd hoped for its original purpose. However, during the trials, researchers noticed something remarkable happening. Study participants reported a significant and unexpected side effect: dramatically improved erectile function. That side effect turned out to be a pharmaceutical jackpot. Researchers realized they had stumbled onto something far more commercially valuable than heart medication. So they pivoted. They shifted their entire focus from the cardiovascular system to sexual function. And as they say, the rest is history. The dangerous myth, where it started. Now, let's address the elephant in the room. There's a widespread belief that Viagra and Cialis are dangerous for the heart, that they negatively affect blood pressure, and that heart patients absolutely cannot take these medications. This myth is deeply ingrained in public consciousness, but it's not true. So where did this myth come from? How did it become so deeply embedded in our collective understanding? The answer lies in a very specific and dangerous drug combination. While PDE5 inhibitors have a remarkably safe profile when used alone, there's one critical exception: when combined with nitrates. Let me explain. Tadalafil, the active ingredient in Cialis, is actually FDA approved for treating pulmonary hypertension. It works because it widens arteries and improves blood flow. Nitrates, as I mentioned, do the same thing. They also widen blood vessels and lower blood pressure. Now, if you combine these two classes of medications, both of which lower blood pressure and dilate blood vessels, there's a serious risk that their effects will add together. The blood pressure can drop dangerously low. We're talking about a precipitous drop that could theoretically bring blood pressure to near zero. This isn't a minor side effect. This is a life-threatening situation. In the early years, when these medications first became available, there were indeed deaths resulting from this combination. These cases made headlines. They were tragic, and they created an understandable fear in the public consciousness. The association became locked in. PDE5 inhibitors are dangerous to the heart. But here's the critical distinction that often gets lost. These deaths resulted from a specific, dangerous combination with another drug class. They didn't result from the PDE5 inhibitors themselves. The safety profile, what the evidence actually shows. When PDE5 inhibitors are not combined with nitrates or non-selective alpha blockers, they have an excellent safety profile with respect to the heart. And I want to emphasize this point. Viagra has been on the market since 1998. That's nearly 25 years of widespread use. If these drugs were significantly harmful to cardiac health, we would have seen overwhelming evidence by now. The evidence actually points in the opposite direction. Let me walk you through some of the cardiac benefits that research has documented. First, PDE5 inhibitors are approved for pulmonary hypertension stemming from left heart disease, and they work through several mechanisms. They improve how the heart contracts, what we call contractile function. They reduce chamber dilatation, meaning they help prevent the heart from becoming dangerously enlarged. And they reduce pressure on the left ventricle, which is the heart's main pumping chamber. We call this a remodeling effect, and it's actually positive. The heart's function improves over time with these medications. The parameters of cardiac action become better. The heart becomes more efficient, beyond just systolic function. The part of the heartbeat when the heart pumps. These drugs also improve diastolic function. That's the part where the heart relaxes and fills with blood. For people with heart conditions, this is significant. PDE5 inhibitors also have anti-inflammatory effects. They reduce inflammation and inflammatory changes in heart tissue. For a heart patient, reduced inflammation is genuinely beneficial. And they improve coronary microcirculation, the tiny blood vessels that supply the heart muscle itself, which means the heart gets better blood flow. Emerging research, the future of PDE5 inhibitors. Here's something that might surprise you. PDE5 inhibitors are currently not recommended in the months immediately following a heart attack. That's the current standard of care. However, and this is important, these medications are being actively investigated for exactly this indication. Why? Because there's growing evidence that the remodeling effects we discussed could benefit heart attack patients. Preliminary research suggests that PDE5 inhibitors can reduce infarct size, meaning they can limit the amount of heart tissue that dies during a heart attack. They appear to increase perfusion, getting blood back to the damaged area. They improve heart contractility, and most importantly, they seem to increase the chances of survival after a myocardial infarction. This is groundbreaking research. We're potentially looking at a class of medications that could not only treat erectile dysfunction, but could also help save lives after heart attacks. As this research continues to evolve and as we gather more evidence, clinical recommendations may change. Beyond the heart, other medical benefits. PDE5 inhibitors display efficacy in conditions far beyond erectile dysfunction. Let me give you some examples of their broader applications. These medications are FDA approved for benign prostatic hyperplasia, or BPH, which is enlarged prostate. They're quite effective at facilitating urination and reducing episodes of urinary urgency. For men dealing with BPH symptoms, PDE5 inhibitors can be genuinely life-changing. There's also ongoing research into applications in pulmonary hypertension, as we've discussed, and in various other cardiovascular conditions. This class of medications really is remarkably versatile. The broader point is this: PDE5 inhibitors are not single-purpose drugs. They're not just for sexual function. They're more like a pharmaceutical Swiss Army knife, a tool with multiple applications, many of which benefit cardiac health rather than harming it. And across all these applications, when used appropriately and not combined with contraindicated drugs, they maintain a high safety profile. The broader context: understanding medical safety and drug interactions. What I want you to understand at the deeper level is that drug safety is rarely about whether a medication is inherently good or bad. It's about context. It's about understanding drug interactions. It's about knowing who should and shouldn't take specific medications. It's about medical literacy. The case of PDE5 inhibitors is a perfect example of how a single dangerous drug combination, nitrates plus PDE5 inhibitors, created a lasting public perception that far exceeds the actual risk. A few tragic cases, headlines, fear, and then that fear becomes embedded in our collective consciousness and persists for decades, even as evidence accumulates showing that the risk was always about the specific combination, not about the medication itself. This happens repeatedly in medicine. A medication gets a bad reputation based on a particular problem, and then people avoid it entirely, sometimes missing out on genuine benefits. PDE5 inhibitors have unfortunately fallen victim to this kind of misconception. Another important point, medications work differently in different people. Your age matters. Your medical history matters. Your other medications matter tremendously. What's dangerous for one person might be perfectly safe for another. This is why personalized medicine is so important. This is why you need to talk to your doctor rather than relying solely on general information. There's also the matter of risk versus benefit. Even if a medication had some risk, which PDE5 inhibitors largely don't, we would weigh that risk against the benefit. For a man struggling with erectile dysfunction, the psychological and relational benefits can be significant. For a man with pulmonary hypertension or certain cardiac conditions, the medical benefits are clear. The benefit-risk calculation often strongly favors taking the medication. The importance of medical consultation. I want to be very clear about something. This is a video, not a medical consultation or medical advice. I'm providing educational information, but medical decisions need to be individualized. Before starting any PDE5 inhibitor, you absolutely should talk to your doctor. If you have any cardiac history, if you're on other medications, if you have any doubt whatsoever, consult with your healthcare provider. If you have significant cardiac concerns, consider consulting with a cardiologist who can evaluate your specific situation. Your doctor can assess your complete medical picture. Your doctor knows your history, your medications, your risk factors. Your doctor can determine whether a PDE5 inhibitor is appropriate for you. Your doctor can also make sure you're not on anything that would create a dangerous interaction. This is especially true if you take nitrates or certain blood pressure medications. These conversations are important. They're necessary, and they're the only way to ensure you're making medical decisions that are right for your specific situation. A final word on evidence-based medicine. Over the course of this discussion, I've shared evidence about how PDE5 inhibitors work, what research shows about their safety, and what dangers actually exist versus what dangers are myths. I've done this because I believe in evidence-based medicine. I believe in letting science guide our understanding rather than fear or misconception. The evidence on PDE5 inhibitors is actually quite reassuring. These medications have a solid safety profile. They have genuine medical benefits. Yes, they need to be used appropriately. Yes, certain combinations need to be avoided. But the blanket fear that these medications are bad for your heart, that's not supported by the evidence. Millions of men have taken these medications safely. Millions more could benefit from them if misconceptions didn't prevent them from having conversations with their doctors about options. I hope that this has helped ease your concerns regarding this class of medications. I hope it's given you a clearer picture of what research actually shows versus what myths suggest. And I hope it encourages you to have informed conversations with your healthcare providers. I'm Dr. Eva Daniel, and I'm committed to helping people understand medical science clearly and accurately. Thank you for watching. Take care of your heart, and please consult with your doctor about any health concerns.